Yang Rui, far beyond this virus outbreak situation, you bet it's intentional. It's been intentional for well over a decade on the part of particular Western mainstream media to demonize China and to demonize them with every opportunity that they possibly can. The part about the situation that's so disturbing this time, which led to the tremendous response to the article that I wrote, was the fact that here we are in a human tragedy. So we're not even discussing a political topic like a business forum or an economic forum or, a trade war. It's not that topic. It's human tragedy. And even when it's human tragedy, did these particular Western media, did they lighten up? Did they change their tune to show more compassion, to show more caring, to show more love? No, not at all. They went ahead and continued politicizing it, and honestly, it's a disgrace. And so many people across the world feel that exactly the same way. And we're sick of it. It's gone on for way too long, and it's probably going to continue, unfortunately.
Around the world. What's been very interesting for me as an impartial observer is to see that when you have a hurricane or when you have a tsunami, when you have an earthquake somewhere around the world, there's usually an outpouring of reaction, especially if it's happening in a developing country. But when you see it here with China, there's been a very different reaction, almost as if the coronavirus is your fault, it came from you, and therefore you figure it out. And I think that's where global solidarity, as Dr. Tedros has said many times, is important, that we collaborate not only in science, but we collaborate across compassion as well.
What does that mean for modernizing China's governance capacity, looking back in our hindsight, wisdom, especially at local level in related emergency response system? Mariel?
Well, Yang Rui, let's look at the result that has happened. The emergency response that has been put into place didn't even exist literally 2 or 3 weeks ago. It's so remarkable how fast it was put into place. And I'm happy to share with everyone tonight essentially what I would regard as breaking news. I'm aware of cities all over China, and I'll speak specifically about where I am on the ground. As Andrew was just saying, he's not here, he doesn't know, and I'm happy to share it with him. We're on the ground here in Shenyang, and we've already beaten the virus. Okay. I mean, isn't that incredible? The Shenyang government has issued back to work orders with 17 guidelines to get back to work. There's been no new cases of the virus in a week. Here in Shenyang. There's been no new cases of the virus in Jilin in 2 weeks. There's been no cases of the virus whatsoever in Fushun. So I can only speak to this city. I'll speak just to Shenyang. I'm saying to you that there's no new cases. There hasn't been. And so we're past it and getting back to work. Now, that's a testament to the comments that the other gentlemen have both made, this incredibly broad, unprecedented, groundbreaking response that has come together from the provincial governments through to the cooperation of dutiful people, everyone willing, including myself, my wife, my son. My boy hasn't been in school for 3 weeks. We're home, we're hunkered down, everyone is doing it, and guess what? Now we have a message to the world, because this is going to be a government sovereign emergency response to global pandemic threat case study. That's what this is going to be, and I'm going to say it right now. The media that has been demonizing China, they're going to start reporting that other countries, including America, are going to look at this case study and what China did, and they're going to adopt what we did. So, how badly did China do, Yang Rui? We did tremendously well because we won. The joy of spring is here. We're going back to work. It's only been 2 weeks. So this idea of, and I can think about what the WHO has to say about these measures. What did we do? We said to everyone, stop school, stop business, go home and stay home. And the only thing you could do, and the only thing there was to do, because all the businesses were closed, was go to the grocery store every couple of days and buy yourself some food. That's all we did for the last 2.5 weeks.
We do appreciate the resumption of confidence of local residents in Shenyang. Andrew, according to the latest report from the Centers for Disease Control and Prevention, the CDC, 92 children died in the U.S. as of February 8th, or week 6 of the official flu season. Among the 92 deaths, 30 were caused by influenza A, and the remaining are caused by influenza B. Influenza B mostly affects children and young adults, while influenza A is more common in those over 20 years old. So the CDC said the reason for a spike in pediatric deaths is that two strains of the flu that are tough on children are spreading in the same season. How are U.S. health officials reacting to the second wave of flu, and how does the threat from H1N1, which critically broke out in the United States, compare with that?
Well, I can kind of start off here by saying that last week I spent 4 days sick from the flu. I didn't get my flu shot this year, so I'm letting you know that's, I'm just coming off of that myself. I think, I like to tell my students, I like to tell others to put in perspective that the flu in the United States, we're going to have over 150,000 people hospitalized, right? 15 to 20,000 individuals will die. Obviously, I mentioned children, which is a tragedy also. This is real, but around us, I've had schools that have shut down locally here in Indiana because of the number of children in elementary school that have had the flu. So they just basically said, we're shutting down the schools. There's not enough kids here. So this is what we're living in almost every season here in the United States. We have more of a nonchalant attitude about it. It's in our population. We have vaccines, we have antivirals, so we tend to take it's just the flu type of attitude. But yet there are a number of people dying each year. I think it's because we have the ability to treat flu. We have the ability to prevent flu through vaccinations. And although I didn't take one because it's just something that escaped me this year. So I always think about that when I'm thinking about coronaviruses. I mean, coronaviruses around us. They're going to be around us. They've been around us for decades, all right? So this is not something that's going to leave. It's something that's going to be with us from now and throughout humanity. It's just a natural process. It's unfortunate that it happened in China. They should not be demonized. It's just what these things happen. It's globally we are in a situation where we are going to the whole world will come. I will continue my research. I've been doing research on SARS since the SARS outbreak. I've never stopped, although funding went way down. We continue to work on our antivirals. So going back to the flu, it's a lot easier for us to accept a disease that's normal in our world when we have the ability to treat with very good vaccines and antivirals. We just don't have those for coronaviruses. If we had that with coronaviruses now, and we knew what to do, things would be markedly different, especially when you consider the overall numbers of individuals involved.
Well, Andrew, I have a little bit of doubt, and I have the benefit of doubt as to your capacity and ability to cure patients of influenza A or B, despite the impact of and the usefulness of your vaccines. You're going to see many infant mortalities, and the rate of fatalities could also be there. It shouldn't be underestimated. So, are you worried that there are going to be more deaths?
Well, yeah, I'm always worried about that, and we will likely have some more. It's a bad flu season compared to some of the other ones that we've had in the past, and it's not as bad as others. So I think, we need to do due diligence. Like I said, I didn't get vaccinated. It was nonchalant about it. But I know that it's a risk every year. I think compliance is an issue when it comes to diseases like this. Individuals just think it'll be okay or I'll ride out the 3 or 4 days. Infants don't have that choice. Children don't have that choice. They need parents and guardians to take care of them, and that doesn't always.
How do you, Andrew? How do you compare the similarities and differences between China and the U.S. in dealing with the epidemic, including the COVID-19 and the influenza?
It may be a little bit difficult for me to compare directly by not being on the ground in China and also not being a healthcare worker. I'm more on the research stage, so I don't. Maybe my WHO colleagues here could comment more